A new free app has been developed to help older Australians monitor their brain functioning and be on the lookout for dementia symptoms. Joining us live to tell us a bit more about the app is Dr. Tanya Petrovich, the Business Innovation Manager at Dementia Australia. Tanya, thanks for your time. We appreciate it. I know that this is one of the biggest fears that a lot of people have who have perhaps had family members, a parent go through dementia, that they too will then follow on a similar path without realising it. So how does the app work? How does it help people?
Okay, so the purpose of the app is for people to monitor their brain health in the privacy of their own home over months, essentially. So every month you play some games, they're fun travel-themed games, and the idea is that you can monitor your progress. If you have concerns, you can then speak to your GP. Because what we find is people are reluctant to speak to their GP or to seek help. So the idea is that through the games, they can monitor privately in their own home, see if there are any issues that they should be aware of, and then speak to their GP.
So what's an example of the sort of game that this app will ask you to do, and how often should people actually log on and use it?
So you need to log in once a month to play the games. The games are varied. So people, when we think of brain health and the possibility of dementia, people tend to think about memory, but memory is only one issue. There are other concerns as well. So for example, facial recognition, spatial navigation. So there's lots of other aspects of cognition that you need to be aware of. And the games actually do that for you by taking you through different activities. Some of them are about memory, remembering people's names, and others are about navigating through a streetscape. So understanding how to, read a map and go back and find your direction through this map challenge. Or it could be a marketplace. So you could be in a marketplace and you've made a purchase and you need to figure out or calculate the amount of money you need to give to the vendor. So things like that to actually test a number of cognitive skills and see if there are any changes in those skills once a month over a period of time.
And Tanya, I guess it's important to say that people shouldn't use this app to self-diagnose. Those results really should be taken to a GP for assessment if they do have concerns. But I assume that these sort of results would really speed up any sort of diagnosis if there is one.
Indeed. So it's not a diagnostic tool, that's quite correct. But I suppose where we're coming from is that our consumers, people living with dementia, have told us that one of the things that held their diagnosis back was either they themselves didn't want to have the diagnosis, so they were concerned about going and having the conversation, or sometimes their GPs weren't having the conversation with them in a timely manner. So yes, the idea of the app is to speed up that process, to get people to understand what the issues are, and also to have that conversation either with their GP or with Dementia Australia to help them along that diagnostic process.
Because early diagnosis can be really important when it comes to dementia, right? There are things that can be done in that early stage, but we know that most people are diagnosed when they're well advanced.
Quite right. So what we're learning every day is there's many things that we can do to improve our cognitive health, and we can do things to stabilise your cognition. So if you are aware that you have issues, there are certainly some things that you can put in place to support you and keep you maintained, if you like, at that level for a longer period of time. So yes, an earlier diagnosis is much better.
Dr. Tanya Petrovich, really appreciate you bringing us up to speed on that. I'm sure some of our viewers might be keen to log in and give it a go. Thanks so much.
Thank you.